So we're going to do a demonstration of the blood pressure, right? So this here is blood pressure cuff, the bulb, right? This is the monitor that we have, and then our patient, right? Now be aware that you're going to be trying to determine the systolic pressure and the diastolic pressure. The systolic is going to be the first beat that you hear on the blood pressure when you're using the stethoscope. Alright? The diastolic, right, is going to be the last beat that you hear while the meter is going back from the highest point where you heard the first beat. Understand? Now, it's not so easy, but with practice, you'll definitely know how to get it done, right? So the bulb, you have to close the bulb, right? You will literally know, so there's a way to open, there's a way to close, right? When it's closed, you realize that once you're pumping, right, it's not on the patient. Once you're pumping, it's getting more and more, right? It's going to go down from the highest point that you have. So the point where you're hearing the first beat, that will be the systolic. The point where you're hearing the last beat is going to be the diastolic. Okay? Once you finish, then you just release. Okay? Now it's recommended that you put it to about maybe 180. Alright? If the blood pressure is higher than 180, then you know that you would have to probably pump it a little before, a little after 180, so you can catch the highest reading. And you have had persons who have blood pressure that is higher than 200. So you have to be very conscious of that, right? The first thing that we do, we ask the patient for their permission. So, hi, my name is Dr. Tracy. May I have your name, please?
Teresa.
Okay, Teresa. Alright, we're going to be doing a blood pressure check today. Okay, is that okay with you?
Yes, sir.
And I have your permission to do so,
Yes,
right?
sir.
So it just involves me putting this cuff around your arm. Alright, so we sanitize. Now, on the blood pressure cuff, you're going to realize that there is a marker. The marker that you have is supposed to go directly at the artery. Okay? Now, the brachial artery is usually a little further lateral, right, to the tendon. So there's going to always be like a tough tendon in the arm. You just go a little bit away from that and you're going to feel the artery. Okay? Put the signal here, above. On some blood pressure cuff, there is an arrow. The arrow will tell you whether or not it's the left, you're supposed to put it on the left artery, or if you're supposed to put it on the right artery. Right? Need a stethoscope. Some machine actually come with their own stethoscope attached already. Okay? And you're supposed to put the stethoscope right under the symbol where you had put the blood pressure cuff, right? Usually, the blood pressure cuff is supposed to be a little above where the artery is at. So if you were to bend the arm, you realize that the blood pressure cuff is not over the joint, right? Because if it's over the joint, then it's like it's restricting movement, right? So it's supposed to be above the joint, right over the artery, right? So her systolic is 152. That was the first beat that I heard. And then I'm waiting for the last beat. You can just zoom in on the monitor. Looking for the last beat.
Steady cotton zoning.
Alright. And the last beat there was at 92. So I'll just release. Okay. So the systolic was 152, the diastolic was 92. So that's 152, 92. Right? So that's a bit high. Right? For hypertensive persons, they're allowed up to 140/90, but the normal blood pressure should be 120/80 or less. Right? Provided that the person has hypertension, then there are different stages of hypertension. You have stage 1, you have stage 2, and you can look those up. But there is a reading for stage 1, which is 139/90, right? The highest it's supposed to be is 89. So 139/89 is stage 1. And then stage 2 goes straight up to as high as 149/80. Alright? So that is something that you guys have to take in consideration when reading the blood pressure, if it's stage 1 or if it's stage 2. Alright? Now in terms of pulse, and then you have hypertensive emergency, right? Which is even higher, which is greater than 180/110. Once the person is having hypertensive emergency, then the person needs to go to the hospital, right? Especially if it's the case that there's sign of damage to the organs, then we consider it a hypertensive emergency. If there's no sign of damage to the organs, then it's considered hypertensive urgency, right? Now in terms of pulse, now you have this aspect of the arm, and you have this aspect of the arm. You realize that the thumb, right? There's an area where you have the thumb. Now the area that you're going to check for the pulse would be the side which has the thumb. Okay? So search for the radial pulse, which is just below the thumb. You're literally gonna feel it. Okay? And then you get a clock, you get a watch, and you're supposed to count from a set point. Okay? How many beats you would have gotten in 15 seconds from that set point. So from, say for instance, it's at 1 o'clock. The second hand is going to reach the 12, right? So when the second hand reaches the 12, and it goes straight down to the 3, which would be 15 seconds, you would be counting how many beats you got in that 15 seconds. And it doesn't have to be exactly at the 12. It can be at the 3, it can be at the 6, it can be at the 9, it doesn't matter, right? Wherever you start, just know that it's within 15 seconds, right? Or you can do it in even 30 seconds. Once you do it in 15 seconds, then you have to multiply the amount of beats that you got by 4. If you did it within the 30 seconds, then you have to multiply it by 2 to get the pulse rate. Okay? So for her now, and for some persons who definitely can use their, they actually have a rhythm that they use, they can actually determine the pulse even without an actual watch, right? But for you, we would want you to ideally determine the pulse using a clock, right? So this is the correct area that you would check for the pulse, okay? And you can note the rhythm and the character of the pulse, okay? You have regular or irregular rhythm, okay? You have the pulse, the strength of the pulse, whether it be a weak pulse or bounding pulse. Okay, you can also have absence pulse, right? Of which majority of the time that's not the case. Alright. So those are the two that I want you guys to focus on for today: the blood pressure and the pulse.